Pharmacy Federation. So for today's presentation, today is a research category. So for today's presentation, I'm happy to introduce Dr. Tahur Gurjit Singh, Associate Dean from Chitakara University, Punjab. Ms. Rituraj Gaur, Principal, Aishwarya College of Pharmacy, Rajasthan. And Dr. B. Wilson, Dayananda Sagar University, Bangalore. So we'll welcome you all. So over to Chavi to continue.
Good evening to all the evaluators, and thank you, Dr. Kairajan, for starting the poster presentation for 7-day and all the participants. So I would request all the participants and evaluators to switch on their camera when they are speaking and a good internet connectivity. If you're not having a good internet connection, then you will be given a chance at the end. Issues. So we would be moving forward to poster number 433. This was poster number 432. eNest 433. Yeah. So just give me 1 second. I'll share my screen. Meanwhile, you can get ready.
You are getting me?
Yeah. Is your poster visible?
Yeah, it's visible. Can you make it full screen, ma'am?
Okay.
Okay. Shall I go, ma'am, then? Yeah. Okay. Good evening to everyone. I am a research scholar from the pharmacy practice, and today I am going to talk about impact of clinical pharmacist collaborative care in identifying and resolving drug-related problems in systemic autoimmune disorders. So, can you, ma'am, introduction and all? Yeah, it's fine. This is fine. Yeah, so in introduction, systemic autoimmune disorders are the chronic and inflammatory disorder affecting multiple organs with the prevalence rate of 7 to 9% globally, and estimated 24.7 million population are affected with this. So due to high disease activity and low remission rate, it's required multiple complex drug therapy. So due to that, there will be chance of get high risk of developing drug related problem. So drug related problem is the a drugs related problem will be affected. So clinical pharmacists will have crucial role to optimize the drug related problem and minimize and manage the drug related problem. So including India and globally, the study literature studies shows there was a lack of evidences or unpublished evidence on the frequency and nature of the drug related problem. So main purpose of our study is to to conduct the this collaborative care, pharmacist led collaborative care in identification and classification resolution of DRPs in systemic autoimmune disorders. So in methods, this was a pharmacist led prospective interventional study conducted in the Department of Rheumatology at Tertiary Care Teaching Hospital over the 18 months, and our multidisciplinary care team was formed to evaluate the DRP and intervention implementation. So patient with any age, gender, diagnosed with a systemic autoimmune disorder and receiving at least one drug for same diagnosis was included in this study. So clinical pharmacists actively participate in the clinical ward round, as well as outpatient visit to identify the patient as well as the collect the data. From that data, patient the DRP was assessed with the evidence-based DRP was assessed and notified the independent multidisciplinary team, and possible this clinical pharmacist intervention plan was formed and implemented in the patient. So the tools used micromedex drug interaction, Naranja scale used for drug interaction, PCNE 8.01 used to classify the identified drug related problems, whereas Naranja scale used to identify the ADRs. So statistical species version 26 used to identify the risk factor for the DRPs. So overall 860 eligible patients were enrolled in this study. Of them 528 patients were diagnosed with RF, followed by the 188 patients with SLE and 100 patients with systemic vasculitis, and 44 with the psoriasis. So mean age of the patient was 48.8% with the standard deviation of 18.6 years, and majority of patients were female. So overall 7,930 drugs were prescribed, that is 9.22, an average of 9.22 drugs per patient, and the majority of drugs were DMARDs followed by the glucocorticoids, and the most of the DRP were associated with the DMARDs therapy. So identified drug related problems identified was there was a total of 1297 DRP found among the 765 patients with an average of 1.69 DRP per patient. Majority of problem with DRP were related to the drug safety as well as drug efficacy. And in subdomain, the drug adverse event was the major drug related problems. So in causes, according to PCNE, there was classified into total seven domain. Of them, the drug use process was the higher number, that was the causes of DRP, that was the 24.13%, followed by the drug selection, that is 22.7%. So clinical pharmacists provided the intervention to all causes, that was 1330 all causes, and of them majority of intervention was provided among the drug level, that is 560, followed by the patient level 468, and uh, of them most of the intervention were accepted, that was the 89.7 and 17%, and that leads to resolution of 90.4% of the DRP. So we identify the predictors using the multi-logistic regression analysis, and identify polypharmacy was the 8.05 chance higher to develop the DRP. So this study conclude that the patients with systemic autoimmune disorders have two-thirds chance to get the DRP, and most of the DRP related to the drug efficacy and drug safety. In the causes, most of DRP used related to the drug use process. So clinical pharmacist led collaborative care can be helped to mitigate the DRPs, as well as this can reduce the burden to the patient and enhance the health related outcomes. So thank you.
Okay, just tell me by what way you can calculate this 860 subjects for your study.
Sir, yeah, sir, we calculate, we use the sample size. That is the patient visit department, sir, per day incidence of patient visit department. So in average of a patient visit was in our department in one day, if we'll like alternative day OPD, as well as patient was 3 to 4. So overall it was calculated 47 patient per day in average. So in that incidence we calculate the sample size, and that was sample size was 739, sir. So overall we got the patient was till now 860.
And what is the total duration of the study?
Sir, in this it is 18 month of a study it is there, but still it is continuing, sir. So the actual study is 3 years, sir, but now it's I am presenting data for the 18 months, sir.
And why there are more female patients are there? Is there any
Yeah, yeah,
scientific or
yeah, yeah, it is there, sir, it is there. So female patients are more because the chance female patients are more because due to the risk factor. Autoimmune disorder generally due to the hormonal imbalance or the presence of genetic factors, the chance of getting autoimmune disorders, the incidence is 3 is to 1 ratio to get autoimmune disorder among the female patient compared to the male patients, sir. Mostly due to the risk factor like hormonal, and as well as the genetic, and some environmental factors, sir.
oh, thank you.
Yes, sir.
So, thank you. Now,
Yeah. Okay.
moving ahead to poster number 4.
Wilson sir, do you have any questions?
Yes, I have one question. I have one question.
Yes, sir. Yes.
Okay, yes. What is your suggestion to overcome this problem? Because you observed so many patients now. So
Yeah, yeah,
this many patients. So what is your
sir.
suggestion?
Yeah, correct, sir. Sir, mainly what will happen in this patient, what I observe, sir, when patient will be taking the therapy, it will be like minimum required for 3 to 4 years. Sometime it may require a lifetime. So what they will do means they will leave the drugs in the middle. Once suppose will have pain, or they will have rashes, or they will have severe inflammatory disorder. So in that condition, what they will do means once they will take tablet and all, they will stop the taking the drugs, or they will shift to the Ayurveda or all. So in that condition, disease autoimmune reaction, it's aggravate and leads to the multiple complication. And in our case, till now 3 patients due to non-compliance to the therapy and not efficacy. So the follow-up of therapy, follow-up is a main problem in this study, sir.
Okay, thank you.
As I identify, sir, follow-up of the therapy and as well as follow-up to the physician is the main.
Okay, that's from my side.
Yeah, okay, sir.